Have you ever felt constantly thirsty, fatigued, or had to make frequent trips to the bathroom? If so, these could be warning signs of diabetes. Hey there friends, welcome back to my channel. Now you've probably already heard of diabetes and you already know that it's no joke. According to the World Health Organization, the number of people living with this illness has nearly quadrupled since 1980. So it's become increasingly important for an individual to know the early warning signs to catch this disease in its early stages. In today's video, we're going to take a deep dive into the profound impact diabetes can have on our overall health and well-being. From head to toe, this condition can wreak havoc on various organs and bodily functions if left unmanaged. So, without further ado, let's talk about the 5 major things that can happen to your body when living with diabetes. Trust me, this is an eye-opening journey you won't want to miss. Also, if you're new here, be sure to subscribe and turn on notifications so you don't miss any of my upcoming videos. With that said, let's jump into the video. Number 1. High blood sugar levels lead to increased thirst and frequent urination. The first major thing that happens when you have diabetes is a constant feeling of excessive thirst and frequent urination. This is directly related to the high levels of sugar, or glucose, in your blood. When there's too much glucose in your bloodstream, it acts like a sponge, pulling fluid from your body's tissues. As a result, your body tries to dilute that extra sugar by drawing water from wherever it can, including from inside your cells. This excess fluid ends up in your bloodstream, triggering your kidneys to work overtime to filter and absorb it. However, the kidneys can only handle so much, and the extra sugar eventually overflows into your urine, dragging along those excess fluids. So, you end up feeling incredibly thirsty as your body tries to replenish the lost fluids, and you find yourself running to the bathroom more often than usual to pee out that excess sugar and water. It's like living in a never-ending cycle of thirst and bathroom breaks. If you've been chugging water and making frequent pit stops, it could be a telltale sign that your blood sugar levels are not normal and it's time to get checked for diabetes. Number 2. Vision problems caused by fluctuating blood sugar. The second major thing that can happen when you have diabetes is vision problems. This is because high blood sugar levels can wreak havoc on the tiny blood vessels that supply oxygen and nutrients to the eyes. Over time, uncontrolled diabetes can lead to a buildup of fluid or swelling in the lens of the eye, causing blurry vision. It can also damage the retina, which is the light-sensitive tissue at the back of the eye responsible for converting light into nerve signals that the brain interprets as images. When the delicate blood vessels in the retina become damaged due to prolonged high blood sugar levels, it can lead to a condition called diabetic retinopathy. This can cause vision loss or even blindness if left untreated. But that's not all. Fluctuating blood sugar levels can also cause temporary vision changes. Have you ever experienced blurred vision right after a meal, or noticed that your glasses seem to work better at certain times of the day? These fluctuations can affect the shape of the lens, causing your vision to come in and out of focus. It's really important that you get this checked out at its earliest. It could be a sign of diabetes. Number 3. Increased risk of nerve damage. The third significant impact of diabetes on your body is an increased risk of nerve damage, also known as neuropathy. This can affect nerves throughout your body, leading to a wide range of potential complications. When you have high blood sugar levels over an extended period, it can cause damage to the tiny blood vessels that supply oxygen and nutrients to your nerves. This deprives the nerves of the vital components they need to function properly, leading to their eventual deterioration. One of the most common forms of neuropathy in people with diabetes is peripheral neuropathy, which primarily affects the nerves in the feet and legs. You may experience symptoms like tingling, numbness, pain, or a burning sensation in these areas. In severe cases, it can even lead to foot ulcers or infections that may require amputation if left untreated. But neuropathy can also affect other parts of your body, such as your hands, arms, digestive system, and even your heart. Autonomic neuropathy, for instance, can disrupt the nerves that control involuntary bodily functions like digestion, bladder control, and sexual function. The scary part is that nerve damage can sometimes occur gradually, without any apparent symptoms in the early stages. That's why it's crucial to maintain good blood sugar control and to get regular checkups, even if you're not experiencing any symptoms yet. Number 4. Increased risk of heart disease and stroke. Alright, this one is really serious, and it can happen when you have diabetes. An increased risk of heart disease and stroke. Now, it might not seem like there's a direct connection between high blood sugar and your heart health, but trust me, there is. When your blood sugar levels are consistently high, it starts damaging the walls of your blood vessels, causing inflammation, which then leads to the buildup of fatty deposits called plaque. This plaque narrows the arteries and makes it harder for blood to flow freely to important organs like your heart and brain. Now, here's where it gets really scary. With those arteries all clogged up, you're at a higher risk of developing coronary artery disease, which could potentially lead to a heart attack if the blood flow to your heart gets severely blocked. And it doesn't stop there. Your risk of having a stroke also goes up if those blood vessels supplying your brain get obstructed or rupture. But wait, there's more. Diabetes can also contribute to other risk factors for heart disease like high blood pressure, high cholesterol levels, and even obesity. Finally, let's move on to number 5, increased susceptibility to infections. For our 5th and final point, we're going to talk about something that might not be as well known. Diabetes can make you more susceptible to various infections. Now, this might not seem like a big deal at first, but trust me, it's a serious matter that you don't want to take lightly. You see, when you have high blood sugar levels, it can weaken your body's ability to fight off infections. This is because elevated glucose levels can impair the function of your immune cells, which are the tiny soldiers responsible for detecting and destroying harmful bacteria, viruses, and other pathogens that enter your body. With a weakened immune system, even minor cuts, scrapes, or skin irritations can turn into major problems for people with diabetes. These small wounds can become breeding grounds for bacteria, leading to stubborn infections that are difficult to heal and may require antibiotics or other medical interventions. But it's not just external infections that you need to worry about. Diabetes can also increase your risk of developing infections in other parts of your body, such as your urinary tract, respiratory system, and even your gums. Uncontrolled diabetes can contribute to gum disease and tooth loss due to the increased risk of bacterial infections in your mouth. So, if you find yourself catching every cold or flu that comes your way, or if minor cuts and scrapes take forever to heal, it could be a sign that your diabetes is making it harder for your immune system to do its job effectively. But the good news is that you have the power to turn things around. By keeping a close eye on your blood sugar levels, following a healthy diet, exercising regularly, and taking any prescribed medications, you can significantly reduce your risk of developing these potentially life-threatening heart and brain complications. It's all about taking control, my friends. That's going to be for this video. Let us know what you think in the comment section below. If you want more videos like this, be sure to hit subscribe and the bell icon. Why not like the video too? It will greatly help the channel. As always, you've all been fantastic. Stay tuned for more videos like this, and I'll see you in the next one. Take care, and goodbye.